It's a chain reaction. Not being able to afford college leads to not getting a degree, which leads to a decrease in the chance of getting a job. And without a job, people are unable to support themselves, let alone a potential family. Jobs in the U.S. have become increasingly unattainable for many who do not have a college degree. However, college tuition is also increasing, which some families cannot keep up with. Students unable to pay for college either have to put it off for a year and work, or they must take out thousands of dollars in loans. Both of these solutions only hurt the students in the end. It causes them to delay their education, their careers, and their life.
This is why we believe in the Healthcare and Education Reconciliation Act. This act gives students the ability to attend 2-year or 4-year institutions with a low cost to families. Through Obama's passing of the act, higher education is more affordable, and financial aid programs such as the Pell Grant can receive more money through expanding this act.
In September of 2009, Congress George Miller's Student Aid and Financial Responsibility Act was passed by the House of Representatives. This act was not passed by the Senate. Instead, it was reworked and attached to the Healthcare and Education Reconciliation Act.
For our country. We have made history here. We'll make progress for the American people. And this legislation helps them all. Thank you all very much.
Obama signed the bill March 30th, 2010. This act is supposed to save $87 billion for the federal government, and that money will be given to financial aid programs.
The Healthcare and Education Reconciliation Act includes several different programs. One such program is increased funds for the Pell Grant, a scholarship program which helps students afford college. Another aspect of the act is that it will cap loan repayment interest at 10% for eligible borrowers starting in 2014. Those same borrowers may also qualify for a loan forgiveness after 20 years. Funding will also go to schools with a majority of low-income and minority students and community colleges. Because the government will use direct loans and not subsidized loans, $87 billion will be saved and repurposed for the programs previously listed.
Some corporations are strongly opposed to the Healthcare and Education Reconciliation Act. They argue that it hurts the free market economy. One such corporation is the Sallie Mae Company. Sallie Mae originated as a federally associated company using Federal Family Education Loan Program. Later, Sallie Mae became a private loans company while continuing to offer federal student loans.
The Healthcare and Education Reconciliation Act caused Sallie Mae to split its company between federal loans and private loans. The act caused the federal loans business to be stagnant, as opposed to the private loans business, which is continuing to thrive. While the act will deter business growth for banks using federal student loans, the act will redirect the money from going to banks to student financial aid programs.
The main student loan program improved by the Healthcare and Education Reconciliation Act is the Pell Grant. The Pell Grant is designed to help low-income students afford a secondary education. It offers a maximum of $5,550 to individual students and doesn't require repayment.
Here's what's at stake. If we fail to pass this bill, the 8 million students who currently receive maximum Pell Grants could see about a 60% reduction in their student aid. Yes, you heard me right. If we don't pass this education reconciliation bill, students could see up to a 60% cut in their Pell Grants. And nearly 500,000 students would lose their aid entirely.
The new act will give the Pell Grant $40 billion. This means that the Pell Grant can reach more students. It is expected to help 820,000 more students. It also raises the maximum amount loaned to a student to $5,975.
Without this act, the number of students unable to pay for college would increase. There would be less highly skilled people in America, and the economy would suffer. Having people who are college educated improves the country.
We now know there's a whole new round of cuts coming at the state level, at the educational level. And the question is whether or not we can take these subsidies and use them for the greater good, use them for the public interest, use them for middle income and lower income families who are striving to provide economic, educational opportunity and economic opportunity for themselves or their children. This is about the character of this nation. And for some to suggest that it's too complicated, it's too this or it's too that. We deal with complicated legislation all of the time. And in this case, we can do healthcare and we can do education. And it's critical that we do both.
Everyone may benefit from expanding the Healthcare and Education Reconciliation Act. In improving higher education, we can improve the lives in the future for Americans.